Hi everyone, thanks for joining. I'm your host, Theodore Henry. In our journey through the pages of Jamaica Magazine today, we'll continue to bring you the latest update on COVID-19 and government's response. Plus, interesting and informative features along the way that will inspire hope and raise your reservoir of knowledge. Sit back and relax as we turn the pages for all that and more. You don't want to miss any of it, so please stay with us.
How would you want to be treated if you were diagnosed with COVID-19? Not like this.
Them will talk how I'm wicked and if it dead and they behave like I am the one that created the virus. All my friends as well that were positive, them going through even worse than what I'm going through. Persons are calling police on them as well.
Do not allow your fear of COVID-19 to rob you of your humanity. There is no need to shun or victimize persons with the disease or those on the front line.
To mistreat persons that do have it, it's not a good feeling. We don't cause this on ourselves.
We really need to cut the hate and work together as a country, as communities to overcome.
Let us be understanding with those affected and support each other. Be kind. End the stigma.
And now for some of this week's major stories inside our GOJ News Roundup segment.
Jamaicans who will be returning to work on June 1 must act responsibly and follow all protocols to lessen the possibility of contracting COVID-19. Prime Minister Andrew Holness made this call on Monday as he addressed the ceremony for the National Labor Day project at the St. William Grand Park in downtown Kingston.
We have to survive the pandemic, but we also have to survive the recession. Two imperatives. We have to work, and we have to work safely. We must go back to securing our incomes. We now have a better understanding as to how the virus is transmitted. We know the measures that we have to take until we get a vaccine. Let us follow those measures faithfully. Let us be responsible. And together, we will overcome this pandemic stronger and better.
He is encouraging companies who can to have their employees work from home where possible while returning their businesses to full capacity. To support the process, a multi-sector COVID economic recovery task force is working to establish relevant protocols to be followed for everyone to get back to work safely. The Prime Minister added that provisions under the Flexible Work Arrangements Miscellaneous Provisions Act should also be implemented.
So we are putting in place all the measures. And with your cooperation, with your faithful keeping of the protocols, we will overcome this pandemic. We will recover our lost productivity. And we will be a stronger economy and society as a result.
This year's National Labor Day was observed under the theme Labor at Home, Clean Up, Fix Up, Plant Up. The national project focused on cleaning the statues of the nation's founding fathers, national heroes Alexander Bustamante and Norman Manley. Also in our news this week, Jamaica's COVID-19 response efforts received a $1 million boost. At a virtual media event on Thursday, the United Nations country team in Jamaica announced that it had mobilized the funds to support two key areas of response. It includes an allocation of $400,000 to support the health sector in suppressing the transmission of COVID-19 while continuing basic health services. Another $600,000 is budgeted to enhance social protection mechanisms. These include the Program of Advancement through Health and Education PATH and other initiatives that support vulnerable groups such as women and children. The public health sector also received a supply of personal protective equipment (PPE) for frontline healthcare workers battling COVID-19. The donation from Food for the Poor Jamaica will go to facilities in the Southern Regional Health Authority. Food for the Poor has also supplied mattresses, critical care monitors, and patient care trolleys to the Bustamante Hospital for Children and the Spanish Town Hospital, among others. In other news, the Bank of Jamaica (BOJ) is reporting that its electronic FX trading platform will be ready for use soon. A pilot phase will be implemented on June 1. The platform is part of the central bank's ongoing reform of the foreign exchange FX market and will facilitate real-time electronic FX trading. Its introduction has been slightly delayed by the systemic impact and distraction of COVID-19, plus the need to fine-tune the system to accommodate specific internal compliance requirements of deposit-taking institutions' DTIs. The central bank says the actual platform, including all authorized FX traders, will be introduced gradually in 3 phases following the pilot. Government is preparing special guidelines for shelters and emergency operations for the upcoming hurricane season, with considerations for concurrently managing the COVID-19 pandemic. Prime Minister Andrew Holness says the guidelines are being finalized by the Office of Disaster Preparedness and Emergency Management (OPM) and the Ministry of Health and Wellness. They will be provided to all relevant entities. He made the announcement on Wednesday during a virtual meeting of the National Disaster Risk Management Council, which he chairs. The Prime Minister says he has mandated that the re-inspection of shelters be accelerated by municipal corporations and other response actors at the local level, given the implications of a health crisis during the hurricane season.
Shelter operations are of particular importance to the government, given the COVID measures of social distancing and the potential for the spread of the virus and the impact on the most vulnerable in our society.
OPM, meanwhile, is ensuring that adequate relief resources are in place to respond to any eventuality, with arrangements being made to procure additional supplies.
To properly carry out a hand rub, apply a palmful of the product in your cupped hand, covering all surfaces. Rub your hands palm to palm. Rub your right palm over the back of your left hand with interlaced fingers and vice versa. Rub your hands palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked. Rotationally rub backwards and forwards the clasped fingers of your right hand in your left palm and vice versa. Once your hands are dry, they are now safe.
How would you feel to know you can stay at home, send a text, call, or web chat and get your prescription medication delivered straight to your home? Well, that is now the case for National Health Fund beneficiaries 65 years and older. Watch this.
Senior citizens in the cohort 60 years and older represent the fastest growing demographic segment of the society, as more people are living longer. This changing dynamic has prompted the government to ensure improvements in the level of responsiveness to new expectations and needs of our seniors. The need for quality healthcare is top of the list. One aspect of quality healthcare service is the prompt access to affordable medication. So the Ministry of Health and Wellness, through the National Health Fund (NHF), has been leading the government's charge in providing critical supplies of medication at subsidized costs to persons in need. That includes seniors. The NHF has been improving its service by employing ingenious means of delivering medication and reducing waiting times and overcrowding at prescription outlets.
We are using a number of services in order to make it easier for our customers. We have the Prescript mobile app. We have a drop-off and pick-up service. We have scheduled refill for persons who come to the pharmacy frequently with the same medication. And we have a number of other initiatives in which we contact clients to work out easy ways for them to receive their medication.
home delivery service for drug-served patients 65 years and older is the NHF's latest addition to its offerings. This emerged as a response to the coronavirus pandemic.
As most people know, the NHF is a customer-centric organization, and with COVID-19 we actually looked at different ways of better serving our customers. Medication delivery is an idea that we have had under active discussion for a number of years, and we found that this was an opportune time to implement this service.
This new service is available to drug-served patients on the NHF's scheduled refill program who have monthly appointments to pick up their medication at a drug-served pharmacy.
So for these patients, we give them 2 months supply of medications, basically. And the feedback is just excellent. It's really great. But when you look at how grateful they are, because some of them they can't walk, some of them they're disabled in terms of hearing and so on. So when you can come to them to actually give them their medications, it's really heart-touching, basically. So that they're very grateful. They say it all the time, and they are loving the service as it is now.
This was started in St. Thomas, and we've expanded into Kingston and St. Andrew, as well as in St. Catherine. And other parishes have now started, St. James and other parishes. And the intent is to have this program island-wide.
The NHF's home delivery service is set to benefit approximately 30,000 beneficiaries over 65 years of age, as well as other vulnerable groups that the fund believes can benefit from medication delivery.
We just received a call, asked if we would want it to be delivered, and we readily accepted it. The wait can be very long. I know they try to cut back sometimes by using the scheduled thing, but even then you have to go, and sometimes they wait up to an hour. So this is just ideal.
Patients may want to check out the NHF's online avenues such as web chat to indicate their need for delivery service. Persons can text their name and their drug-served pharmacy to 876-219-9937 or 876-219-9929. They can also call the NHF at 876-906-1106 from 8 a.m. to 4 p.m. weekdays.
I take the opportunity to commend our pharmacists, our pharmacy technicians, and all the team who facilitated this.
This is a good service, man. They say must stay at home. And this service that you come and present, a wonderful service.
We are loving the service. We really appreciate it, and we wish it would continue.
Customers need not worry about having a National Health Fund NHF card or a Jamaica Drug for the Elderly JADEP card. The service will still be offered.
But at this time, when we come and realize that, oh, probably you don't have a card, what we can do is give you the steps as to how to get the cards. And in order to access the cards, it's a same-day printing at any of our drug-served locations that are named for that service.
The NHF, reaching out, helping to make Jamaica the place of choice to live in good health.
Come June 1, more people will be heading back to the workplace as stipulated by the government's planned phased return of economic activities as the country succeeds in flattening the COVID-19 curve. Let's find out more in this update.
As indicated last week, the current work from home orders will expire at the end of May. As of June 1, persons other than our vulnerable population, that is, persons aged 65 and over, and persons with comorbidities, will be allowed to return to work. The PSOJ has been working with the health authorities, and we are well advanced with developing the infection prevention and safety protocols that would be needed for the workplace. I've heard the concerns of certain groups from certain quarters, and I want to take this opportunity to clarify the government's intent in allowing the work from home orders to expand. We're not saying that everyone should return to work regardless of their circumstances. We acknowledge that there are persons who would have responsibilities by virtue of schools being closed and having children at home to attend to. We acknowledge, and we have said, that there are persons with comorbidities who should be very careful how they return to work. And therefore, we expect that the employers would exercise a high level of understanding in this period. But we also have the obligation, the duty to return our economy to its full productive capacity as quickly as possible. So our theme, our new theme, is work safe and work smart. So work that does not need physical presence at the workplace. We are encouraging our employers to dialogue with their employees, negotiate with their employees, use the facilities that are available under the flexible work arrangement legislation to put in place the framework, the measures, the systems, the solutions that will ensure that persons who have children at home, by virtue of school being out, persons who are ill, if they can be facilitated with these measures, let us use them. We have had this law for the last 6 years. It hasn't been fully utilized. Let us utilize it now. There is a sense as well that the government is moving too quickly to reopen the economy. And I want to address this point briefly. The Jamaican government has been very careful not to shut down the economy. Somehow, in the crescendo of opinions, we forget that there was an overwhelming call from certain quarters to shut down the economy. I mean, it's as if those calls were not made. The government did not respond to that. The government outlined a process that if cases reached a certain level and it became situationally appropriate, then we would still act, but with measure. And you would have seen that where it became appropriate, the government acted proportionately in a measured way, using the available data. And so you would have seen the government utilize community quarantine. We had lockdown of one parish, and we contained workplace clusters. But we never shut down the entire economy. We took measures to control our borders, and we have been doing that from the start. From even before the first case came to Jamaica, we put in place travel restrictions, and we gradually tightened those restrictions till we reached the point of closing the borders to incoming passenger traffic. And now we are at the point where we have to now change those restrictions to allow for the full operation of our economy.
I must say that we are pleased with the response from the the operators of bars across the country. We have sampled since the period that the order was lifted, more than 2,500 bars have been inspected. And we are seeing where the general acceptance of the guidelines that has been laid out, Prime Minister, have been met. We have seen where, especially in the corporate area, there's a very high percentage of compliance with operators taking the necessary steps to ensure in the areas such as where there are no stools, benches, chairs, or tables. We have seen a high of over 60% in those areas, where we have asked where gaming operations in terms of machines are placed in areas where social distancing can be practiced. That is one area that we are not happy about, because we are only enjoying over 30% compliance in that area. In terms of putting in the necessary facilities, we see where the bartenders are wearing masks, a high of over 70%. The presence of washing areas and sanitization for persons attending the bar, over 70%. We're seeing where the observing of the curfew hours is extremely high. Over 90% of the operations are complying with that order. And surprisingly, Prime Minister and colleagues, in the area of 5 persons, including the bartender, based on the survey that we have done, over 80% compliance in that area, and that is one area that we are very pleased. We are also observing the same discipline within the areas of the dominoes and other games, where the compliance is relatively good. Prime Minister, one of what we have found in the exercise that we have been undertaking is that a significant number of these bars are operating without the requisite permits, spirit license, food anglers permit, trade license, etc., is one thing. But a protocol is being worked out between the Ministry of Local Government and the Ministry of Justice to ensure that we work with these operators to comply fully. And the last thing, Prime Minister, this survey that is being conducted on over 11,000 bars, village bars and taverns across the country, is not the final decision. We are doing an exercise that will determine, but the final decision is that of the Ministry of Health, and they have been working closely with us to ensure that we do the survey. So we are expecting that by the end of the 14 days, we would have surveyed almost the majority of those bars that are open and are operating. But overall, we are seeing a positive response from the wider public on this matter.
Social distancing is one of several buzz terms we all must keep in mind as a crucial safeguard to control the spread of the coronavirus. It's not about shunning, scoffing at, or ridiculing anybody. It's about respectfully keeping your distance 3 to 6 feet away from others and avoiding large gatherings.
Apart, but still in it together. United, though not physically. Welcome to the period of social distancing, an important method to contain transmission of the novel coronavirus, COVID-19. Social distancing keeps people from interacting closely or frequently enough to spread an infectious disease. Social distancing involves minimizing contact with people and maintaining a distance of at least 1 meter or 3 feet between you and others. It also extends to avoiding public transportation as much as possible, limiting non-essential overseas travel, working from home, and skipping public gatherings.
For persons who are particularly sociable, really you should keep down the group meetings. I know it's difficult, but please, And at a time when persons are visiting or so, the hugging and the kissing, no. As much as possible, just cut that out until COVID is gone.
Locally, schools and other gathering places such as bars, nightclubs, and similar areas of entertainment have been ordered closed. A number of large events such as sporting activities have also been cancelled. Even if persons must gather, then the social distance rule of 1 meter must be adhered to. Also, no more than 10 persons are allowed to congregate within the same space at a time. Markets, supermarkets, corner shops, restaurants, and cook shops, which remain open, should at all times do so with a limited number of persons.
Gatherings in any place shall not exceed 10 persons. And this one has to be strictly enforced.
The Jamaica Urban Transit Company JUTC is also subjected to the policy and is permitted to carry seated passengers only. Likewise, taxi operators are required to carry one less passenger than they are licensed to. Social distancing is a tested and proven method to limit the spread of a virus. This strategy saved thousands of lives during both the Spanish flu pandemic of 1918 and in Mexico City during the 2009 flu pandemic.
What we are trying to do is to institute the measures that we believe will inure to greater practice of social distancing, which is what is now being recommended as the most effective way of controlling the spread of COVID-19.
Please note, it is okay to go outdoors, particularly around your yard space if you do have one. Being close to the garden is especially recommended for seniors who may need to maintain exercise of the limbs. The point is not to remain indoors, but to avoid being in close contact with others. When you do leave your home, wipe down any surfaces you come in contact with, avoid touching your face, and frequently wash your hands. Here are some tips to help you maintain social distancing. When you go grocery shopping, buy as much as you can at a time to minimize the number of trips. In addition, select a time when the store is least likely to be crowded. Avoid dining out. You may opt for takeout or delivery service. If you must take public transport, do so during the off-peak hours and avoid taking vehicles that are full. At work, implement the remote work or staff rotation policy to decrease the number of persons within the same space at a time. Also consider virtual meetings.
In some places, we've seen pictures where they're conducting a meeting and they have the chairs, they have the space marked out for the chairs, so they have a little square on the floor and they're separated.
Delay trips to crowded venues like the park or malls. The best mechanism to ward off COVID-19 and other contagious viruses is to stay home. If you must venture out, practice social distancing. In addition, take a hand sanitizer with you and use it after touching surfaces and door handles.
Some persons are not comfortable with hand sanitizer, so I'm here to tell you that the hand sanitizer is just as good as soap and water. If you can get hand sanitizer, make sure you check it to see the percentage of alcohol. It shouldn't be less than 60% alcohol. We recommend 70, but sometimes it's hard to find the 70%. So if you see the hand sanitizer and it has 60% alcohol, that can work. If you can't see the concentration of alcohol, do not buy that hand sanitizer.
End of today's program, but be sure to join us again tomorrow for another informative edition. Until then, continue to watch these and other programs by logging on to our website at jis.gov.jm or subscribing and clicking the notification bell on our YouTube channel. You may also find us on all the major social media platforms and through our mobile app that's both Android and iOS compatible. On behalf of the entire production team, I'm Theodore Henry, urging you to stay COVID-19 free.
This has been a production of the Jamaica Information Service, the voice of Jamaica.